We will invite our chief instructor of the course, Dr. Twinkle Shah, and he is going to talk to us about new generation IOL power calculation formulae and overview. Dr. Twinkle.
I'm very much thankful to the scientific committee chairman Dr. Partho Vishwas and the organizers to giving me this opportunity. My today's focus is on the next generation IOL power calculation. In era of 2020, we were going for the excellent effective outcome. But now in 2023, the expectation is the beyond excellent effective outcome. So the progress in the IOL power calculation is the advancement in the imaging devices, which will be taken care by the Dr. Harshul Tank for the optical biometries and the newer IOL power calculation formulas, software for the data integration, and the post-operative reflection adjustments. But today's focus will be on the newer IOL power calculation formulas. In 2017, Dr. Kwok has introduced a new classification rather than going the first generation, second generation or third generation. He has simply divided according to the way of the working of the formulas, like a historical or regression based formulas or regression formulas. The version formulas, Gaussian optics, where we all are using since so many years, like all are working on the basic principle of the cornea as a single plane, lens as a single plane, and you calculate the effective lens position by using the different variables. So variable like a third generation formula where axial length and the keratometry and the Higgins formula and the Ladas formula using the antechamber depth, or Barrett universal 2 was considering the two more modality of the variables like lens thickness and the white to white, and Holiday 2 was considering the edge factor and the preoperative refraction factors. Then the artificial intelligence comes place. The Hill RBF is also giving exclusively based on the artificial intelligence, but so many other formulas are coming up which are incorporating the theoretical model along with the artificial intelligence formulas. And of course, the way the ray tracing formulas are also coming up, that is the different optics, the pure optics phenomena, where the oculics or phaco optics or Olsen formulas are also has been classified. So the newer updates of the newer equipments like optical biometers are now have very much minimal error with the IOL power calculation is the contribution, and then more and more advanced is the like Argos optical biometer, where there has a segmented optical biometry has been also measured. The same way the keratometry has been also very well measured by the front surface of the cornea or the back surface of the cornea, and you can calculate by the vector addition by the simplex images or the OCT or color-based LEDs. So the source of error in the magnitude of IOL power calculation is the effective lens position, not the keratometry measurement or axial length measurements. So why the majority of formulas are imperfect for the ELP issues are there? When the normal eyes are there, all the formulas are working very well. But when there is abnormal eyes, short eyes or very long eyes, or have abnormal eyes like antechamber, anomalies like small antechamber with the normal eyes or large antechamber with the normal eyes. In such conditions, this ELP issue is coming up. So the newer formula has to be evolved. So as and when newer formulas are evolving, we are taking the more and more predictors or variables taken in account. Now majority of the formulas are considering the lens thickness part, or some are also considering the white to white thickness, or some are considering the like Panacek, the corneal asphericity part or posterior anterior ratio of the cornea has also been considered by the different formulas. So which formula to be used in 2023? So left side is all the formulas we were using. Now the EVO, Hill, RBF, Offer 5, Panacea, Pearl DGS, VRF, so many formulas are coming up. So it is now confusing what to use and when to use. So which formula in 2023? The top formula commonly used are the Barrett Universal 2, CAN formula, Hill RBF, calculator version 3, Olsen, Offer QST has been recently introduced for the long eyes, EVO formula, Pearl DGS, Barrett 2 axial length formulas, Betal formula. This is exclusively made for the design for the sum of segment biometries. So we go briefly one by one to all of them. The Barrett suite, which is available in so many equipments like IOMaster 700, they have three components. One is the non-toric component where the Barrett Universal 2 formula can be used. Toric IOL, Barrett toric calculator is also incorporated, and patient of the post-refractive surgery where the Barrett 2K formula has been used. Two more formulas are also available on the APS website of the Barrett. That is a Barrett treatment formula for the post-operative refractive surprise management, and Barrett Toolkit toric calculator where the post-refractive surgery toric IOL calculations. And the Barrett formula is mainly theoretical model with using the 5 variables, which is a thick lens based formula. So they have two factors. One is the lens factor, which is like our A constant of the SRKT, and the design factor, like I suppose a biconvex lens, the design factor will be changed, and the meniscus lens, like high myopic lenses, then the design factor will be changed. And the Barrett toric calculator also taking the care of the posterior corneal power, whether it is estimated or measure can be used. HIL RBF calculator, that is a version 3 calculator. They are artificial intelligence machine learning process, that is adaptive learning. And it is initially when HIL RBF has introduced the version 1, it was considering as a target hemetropia with only 3 variables. Now they are incorporated the 8 variables. They are also incorporate the data set of the small short eyes or very short eyes or small long eyes and very long eyes. And also rather than target hemetropia, you can also customize point plus or minus 0.25 and plus 0.5. Ray tracing formulas are also purely on the pure optics, very useful for the complex cornea, particularly when the corneal scar is there for post-refractive surgeries. In such corneas, they works very well. Where the keratometry readings are not properly, the ray tracing formula works very well. Also is one of the ray tracing formula where the another factor C constant is already there. That means there is a position of the IOL in the fraction of the capsular bag. So that C constant has been taken along with the Olsen formula. Newer formula like a EVO formula, that is based on the theory of hemetropia factor or hemetopization, which is generating the hemetropia factor. It is also thick lens based formula, so it works very well when there is a meniscus lens are used. Ken formula, it is also nearly equivalent to the Barrett tube formula, but it has also incorporated the regression factor and the artificial intelligence component. They are maintaining the accuracy and the extreme of the excellence. Per DGS calculator, this is another good calculator. These 3 gentlemen has introduced this calculator, and it is works based on the artificial intelligence and pure optics. And they have another additional advantage that they can adjust the prediction of the post-operative data of the control little eye. So suppose you have a refractive error in the one eye, so you should use for the per DGS calculator where you can go for the other eye correction. This is the most recently introduced is the ES series IOL calculator, which is available to all of us free online and which incorporates so many formulas, that is Barrett, Cook 6, EVO, HIL RBF, Offer Q, CAN and per DGS. Just we have to put the data and all 7 formulas are coming up as a result. So it works very well for us. The latest evidence is that the CAN is the most accurate. This study was conducted by the Millis, and the CAN was considered as one of the best formula for that. And Olsen and Barrett also similarly well. So so many formulas are there. How to incorporate these formulas in the practice? I will just briefly go through it. Then you should have a strategy for that. Till now we were considering each and every formula to be calculated separately, and we are optimizing it. So like this patient, suppose patient is a myopia, and I have selected a 17 diopter lens. The spherical equivalence is plus 0.707. Now because we have a calculator, now we can calculate so many formulas at a time. So put this data, you will get the results. And suppose you go for the 16 diopter, calculate which is the range of the corrections in the different formulas. So plus 0.17 to plus 0.06. And this is 16.5, the range is minus 0.5 to 0.26. So being a considered patient as a myopic, I would like to keep a little bit more on the myopic side. So 16.5 diopter lens has to be selected. So now you can incorporate so many formulas at a time, which is real time available online on ES series calculator.